Hello and welcome to your own channel Langsuk because every breath matters, and I'm your consultant pulmonologist Dr. Ankush. I welcome you all to part number 3 of the series which we have started on pleural effusion, the accumulation of the pleural fluid in the pleural cavity. In the previous two videos, we have already learned about what is pleural effusion, what are the various causes of pleural effusion, and what are the symptoms in the part number 1. So do watch that video. And in part number 2, we went ahead and learned about the various diagnostic algorithms and the diagnostic test which is required for diagnosing correctly a case of pleural effusion. Thank you so much for watching the previous videos and sending us so many beautiful messages, and I'm truly grateful that you people are finding the content valuable for you and your family members. So in today's video, the part number 3 of pleural effusion, we are going to discuss about treatment modalities, the treatment protocols for pleural effusion. So stay tuned. First of all, now we have learned about how to diagnose it correctly. We have already seen that whether it could be an exudative effusion or it could be a transudative effusion, whether it is because of infection or inflammation or because of cancer, or it is because of certain systemic disorder, body में किसी और परेशानी की वजह से है. So the treatment is also dependent upon the underlying cause. For example, a patient comes out to be having a tuberculous pleural effusion because of tuberculosis. So that patient will be given anti-tubercular therapy, and anti-tubercular therapy details we have already discussed in our videos on tuberculosis. Then if a patient is having because of pneumonia, then that particular patient is given antibiotics which can cover that particular organism which is causing pneumonia, and the duration of antibiotics in such cases is usually 7 to 14 days. In certain cases might be prolonged also for 21 days or even 4 weeks. That is all dependent upon how the clinical course progresses. Then coming to other causes, like if patient is having inflammatory conditions like autoimmune conditions, usually in such cases the combination of medicines which is required is steroids plus immunomodulators. Then if a patient is having a malignancy, so in cases of malignancy or a cancer patient, the diagnosis of pleural effusion makes it a disease which is widespread or metastasized. In these cases, palliative treatment is being offered, like drainage of the pleural effusion. It could be therapeutic drainage, or the patient might require an intercostal drain, like means a chest tube which is put inside the pleural cavity so that the fluid could be drained. And we have already put one video of 5 minutes life-saving procedure of what do we mean by a insertion of a chest tube, and how quickly it could be done, and how beautiful and how life-saving it is for a patient. Then in certain rare cases, like we discussed about eosinophilic pleural effusion. So in eosinophilic pleural effusion, one treats the underlying cause for eosinophilia and the effusion automatically and spontaneously disappears. Usually these patients require treatment with steroids. Then other conditions like rare causes which we have discussed is hemothorax. Hemothorax almost always require drainage with an intercostal drain. Similarly is the case with the pyothorax, that is a collection of the pus in the pleural cavity, that also always requires drainage with the intercostal drain. Now the intercostal drain in such cases could be a small bore pigtail catheter, or it could be, depending upon the consistency of the fluid, it could be a wider bore intercostal drainage tube. Then coming to systemic disorders, like systemic disorders we have discussed about chronic liver failure. The patients with liver fibrosis are there, CLD patients. Then patients with chronic kidney disease, or patients with congestive heart failure, or patients with hypoproteinemia, anemia. Now treating these underlying disorders also leads to the resolution of pleural fluid. So for example, a patient is having congestive heart failure when the ejection fraction of the heart is low. So when the diuresis is being started, so it not only removes the excess of water from the body, it also drains out the fluid from the pleural cavity. Similar is the cases with the chronic liver diseases. Whatever, when the treatment is being started for chronic liver diseases, the pleural effusion usually drains by itself. And like chronic kidney disease patients, they may or may not be on dialysis. In certain cases, dialysis is very, very helpful. And only when these systemic disorders are not being treated either properly, or when the disease is refractory, they might require in certain cases, or the patient is having severe breathlessness. In those cases, we might require a therapeutic pleural fluid removal or an intercostal drain insertion. Usually in the cases of systemic causes or the transudative pleural effusion, an intercostal drain is not required, but that depends upon the clinical condition of the patient. If the patient is having severe breathlessness, then it might be required. So in today's video, we have looked at the treatment protocols or the treatment modalities which are available for treating a case of pleural effusion, be it tuberculosis, be it pneumonia, be it malignancy, or because of autoimmune condition. Each of one we have discussed, or it could be because of the systemic disorders like chronic liver disease is there, chronic kidney disease is there, wherever dialysis is possible or intercostal drainage is required. So we have discussed about the treatment protocols which are available. Now one more thing which is important, there are certain cases where the effusion is recurrently filling. For example, a malignancy patient is there, or a patient of autoimmune conditions is there. Usually most commonly in the malignancy patients or the cancer patients, a recurrent filling pleural effusion. For example, what do I mean by recurrent filling is that you have treated it once but it recurs. So in those conditions, as the fluid is accumulating between the two pleural layers which are outside the lung cavity, as the fluid is accumulating in the two pleural layers which are outside the lung, so in certain cases, whenever there is a recurrence of the pleural effusion, we can inject certain substances into the pleural cavity. Certain medicines are injected in the pleural cavity which can lead to adhesions between the pleural layers, so that the two pleural layers get adhered together. दोनों pleural layers आपस में चिपक जाती हैं कुछ दवाइयाँ डालने से, and this procedure is being termed as pleurodesis. So pleurodesis also could be offered as a treatment modality, as a palliative care modality in patients, usually those who have the recurrently filling pleural effusions. So these are the various kind of treatment protocols which are available for patients with pleural effusion. This is all from my side for today's video. Thank you so much for watching the video, and please like the video, share it amongst your friends and family, those who need the important information on respiratory disorders. And thank you so much. Please subscribe to the channel. Myself, Dr. Ankush, consultant pulmonologist, signing off for today.